Today we will talk about the details in pelvic anatomy. Pelvic anatomy has a philosophy, so we will start with the bony structures. This is the sacrum. The first sacral vertebra level is the promontorium. Here, the frontal edge of the first sacral vertebra. This is the promontorium. And this is the L5 vertebral level. The sacrum is connected with the hip bone, and laterally at the superior side we can find the ilium bone, and posterior inferiorly, deeply at the pelvis, we may find the ischium bone, and anteriorly we will find the pubic bone. Pubic bone goes laterally with the superior pubic ramus, and here you can find the superior pubic ramus here. This is the continuation of the superior pubic ramus. And the line which is passing between the promontorium and the midpoint of the ilium and the superior pubic ramus and the pubic bone and this end structure forms the linear terminalis, which differentiates the lesser pelvis, the real true pelvis, and the false pelvis. And the false pelvis lies at the area of the ilium bone,
fossa iliaca.
And this is the iliopsoas fascia. When we dissect the pelvis, we will understand that all the abdominopelvic cavity is covered by the peritoneum. And this is the iliopsoas fascia, which is a continuation of the parietal peritoneum at the anterolateral abdominal wall. And when we cut it, we will find here the psoas major muscle also, and specifically the iliacus muscle. And this is the lateral femoral cutaneous nerve, which is passing in the line of the iliopsoas fascia. And between the iliacus muscle and also the psoas major muscle, we will find the femoral nerve. Here it is. It passes at the inferior side in surgical supine position. I will talk in this for the surgical supine position. The femoral nerve passes from the inferior side of the inguinal ligament, and the inguinal ligament is formed between the anterior superior iliac spine and the pubic tubercle level, with the extensions of the aponeuris of the external oblique muscle. And this is the psoas major muscle, and anterior to it we will find the genitofemoral nerve. This lies anterior in normal anatomical position, but I will talk about the surgical supine position. It lies at the superior part. And it has two branches, the genital and the femoral branch. Femoral branch accompanies the femoral nerve, and the genital branch accompanies the round ligament, and it passes from the superior side or the anterior side of the inguinal ligament and passes through the inguinal canal to the labium majus area. And when we go medially from this area, we will find the external iliac vessels which are attached to the psoas major muscle. Firstly, the external iliac artery, which is the continuation of the common iliac artery. Here you can see at the medial portion of the psoas major muscle, and also the external iliac vein here, which lies at the inframedial portion of the external iliac artery. And here it is. The external iliac vein and the external iliac artery passes from the posterior side of the inguinal ligament, and they form the femoral artery and vein at the femoral region, femoral area. And also the femoral nerve passes towards the femoral region. And at the lateral side nerve, medially artery, and more medially the vein lies like the abdominal structures. And the ureter, this is it. It passes anterior or superior surgical position, superior to the common iliac artery. At the right side, it passes slightly close to the external iliac artery at this level. Here you can find it. And when the ureter crosses the common iliac artery at the superior side, it goes medially and inferiorly. Here you can find it. Firstly, it passes lateral to the rectum, then lateral to the uterus isthmic level, and later lateral to the bladder, and enters the bladder at the trigonal region. when the ureter passes at the superior side of the common iliac artery, it travels at the lateral part of the rectum. And this is the medial portion for the pelvis, and the ureter lies attached to the posterior leaf of the broad ligament. And at the lateral part of the ureter, we will find the internal iliac artery. Here you can notice it. And the internal iliac artery arises from the iliac bifurcation here. The iliac bifurcation gives the external iliac artery and the internal iliac artery branches. This is the interiliac region. Here you can find it. And at this area lateral to the internal iliac artery, we will find the external iliac vein. This is it. And internal iliac artery is very important. It has visceral and parietal branches. The visceral branches supplies the rectum, uterus, and the bladder. The most important branch for the gynecological practice is the uterine artery branches. It's the first medial branch. Here you can see it. It travels to the obliquely to the level of the isthmic uterus, and it passes from the superior side of the ureter. Here you may find it. When we cut the uterine artery at the level of the internal iliac artery and we mobilize this uterine artery with the parauterine tissue, we will find the ureter to the level of the ureteric tunnel close to the bladder junction, uretrovesical junction. And here at this area there's also tissues, vesico-uterine tissues that we need to mobilize, which covers the ureter from the anterior side. And these branches of the visceral branches of the internal iliac artery are very important. And after the uterine artery branch, if we dissect this area parallel to the uterine artery, we will find the superior vesical artery. And this longitudinal continuation of the internal iliac artery is the umbilical artery, which is an obliterated branch after the birth. And laterally, we will find some parietal branches, and this is one of them. Here you can find it, the obturator artery here. And deeply at the posterior side here at the interiliac region, and which is at the medial part of the external iliac vein, this is the superior gluteal artery. Here you can find it. It travels to the posterior superior side of the pelvis. At the lateral part of the pelvis, we will find the obturator region. But firstly, someone needs to understand the pelvic avascular spaces. The bladder lies at the anterior, the uterus at the middle, and the rectosigmoid colon lies at the posterior portion of the pelvis, at the midline. Lateral to the bladder, we will find the avascular area of the paravesical space. And this space lies between the bladder and the caudal edge of the external iliac vessels. At the medial edge, we will find the obliterated umbilical artery. It attaches to the bladder and forms the umbilicovesical fascia. And at the lateral edge, we will find the caudal part of the external iliac vessels. And deeply, we will find here arcus tendinous fascia pelvis, the continuation of the arcus tendinous levator ani. This is the obturator internus muscle, and laterally and medially at the deep side we will find the pubococcygeus muscle. The condensed tissue between the obturator internus muscle and pubococcygeus, especially the levator ani muscle, covering them, the fascia structure has a condensed nature between them and forms the arcus tendinous fascia pelvis. This is it. It keeps the pelvis in a steady position. And this is the paravesical space. At the lateral part, we may find the obturator fossa, which harbors the obturator nerve. This is it. The obturator nerve passes at the inferior portion of the external iliac vein. Here you can find it. And the obturator vessels accompanies the obturator nerve at the inferior side. This is the obturator artery, and this is the obturator vein. Here you can find it. And these obturator vessels may have anastomosis with the pubic vessels, pubic anastomotic vessels. This is the coronomortis vessel here. That is. The coronamortis vessel is an anastomotic branch between the external iliac or inferior epigastric vessels and the obturator vessels. Here you can find it. These anastomotic branches enter the obturator canal at the medial portion of the obturator nerve. And this is an important anatomical structure. These anastomotic branches, vessels, enter the obturator canal here at the medial portion of the obturator nerve. Then the obturator nerve leaves the pelvis from the obturator canal, which is formed at the superlateral part of the obturator femur. And this umbilicovesical fascia, which is attached to the bladder, perivesical fatty tissue, is very important in surgical practice. When we found it and dissect it from the perivesical fatty tissue, we will find the visceral branches of the internal iliac artery. Here you can find it. If we develop this medial area, this is a dissection and traction bias, and we lateralize. When we lateralize the umbilical artery, we will find the visceral branches, supravesical or uterine artery, very easily. This is very important. And the umbilical artery divides the perivesical space into two parts: lateral perivesical space and medial perivesical space. So this is important for pelvic dissection. And lateral to the rectum, like the perivesical space, there's a space, potential space, avascular space, the parectal space between the ureter and the internal iliac artery. The ureter lies at the medial side and the internal iliac artery lies at the lateral side. Inferior to the internal iliac artery, we will find the internal iliac vein here. It's very important for pelvis. Actually, it lies at the lateral portion of the internal iliac artery, but in some cases, during dissection of the pararectal space between these anatomical structures, there are many small branches that travels towards the ureter, and during developing this area they may bleed. So the surgeon must be careful for the internal iliac artery, small branches, and also the internal iliac vein here. And during ligation of the internal iliac artery, one should keep this in mind, that the internal iliac artery is mostly suggested to be ligated at the distal portion of the supraegluteal vessels here, at this area. But it's not always easy to develop this area and ligate the internal iliac artery lateral distal to the supraegluteal vessels. But during this step, the surgeon must be careful about the external iliac vein, which lies lateral to the internal iliac artery, and internal iliac vein at the inferior portion of the internal iliac artery, and the ureter at the medial portion of the internal iliac artery. So find the ureter first, develop the pararectal space superficially, identify the external iliac vein like this, and be careful about the internal iliac vein and ligate at this area. And this is very important. Also, the ligation can be done at the proximal part here before the supraegluteal vessels in some cases. So at this area, the surgeon must be careful for the iliolumbar vessels and lateral sacral vessels. Lateral sacral vessels are very important, and the iliolumbar vessels travels just superior and posterior like the supraegluteal artery. And deeply to the ureter, we will find some autonomic nerves at the medial area of the pararectal space. These are the thoracolumbar plankings. These thoracolumbar plankings merge and form the superior hypogastric plexus. Actually, that's found at the caudal portion of the inferior mesenteric artery, but sometimes it will be found at the anterior portion of the promontorium or L5 vertebra, anterior to the left common iliac vein. Here you can see the left common iliac vein between the two common iliac arteries, and it's a very important landmark. This is the superior hypogastric plexus. It's a sympathetic and it has main sympathetic and also parasympathetic innervation effect. The main trunk from the superior hypogastric plexus travels with the hypogastric nerve to the pelvis. Here you can find the hypogastric nerve. It conveys the sympathetic innervation to the pelvis at the inferior portion of the ureter. You may find it approximately 2 centimeters inferior to the ureter here at the medial part of the parietal space. This is it. And this hypogastric nerve merges with the parasympathetic nerve fibers which are coming from the pelvic splanchnic nerves. Here, at the lateral part of the parietal space, deeply, we may find some nerve branches. These are arising from S2 and S4. These are these. These are the pelvic splanchnic nerves. Here you can find. They travel obliquely towards the hypogastric nerve, and they form the inferior hypogastric plexus when they meet. And the branches towards the bladder arise from this area, bladder nerve branches, here these are, and they run towards the bladder ways at the inferior ureteric portion, but they have some connections with the vesicovaginal plexus vessels. Here these are the vesicovaginal plexus vessels, and the bladder nerve branches of the inferior hypogastric plexus runs at the medial and superior portion of this vesicovaginal plexus vessels. They are very important. This is the nerve structure and venous plexus structure of the pelvis. And here we will check this area from the lateral side. Here we will check this area from the lateral side, and we can find these pelvic splanchnic nerves here again, hypogastric nerve again, and the bladder branches with the vesicovaginal plexus vessels. Here I will show them to you, pelvic splanchnic nerves, which are arising from the medial portion of the internal iliac vein from the S to S4 vertebral level, and also you may find the somatic nerve of S2 here, which is throwing laterally at this area. And these branches, these small nerve branches, accompany some veins here, but mostly they are found at the inferior portion of these veins. Here you can see the nerve plate lies inferior to the vesicovaginal plexus vessels or the main tributaries of the internal iliac vein. Here you can find the vesicovaginal plexus vessels, or sometimes superior, middle, and inferior vesical veins. And these are very important for the bladder functions, that reserve function, because they lie at the inferior portion. And when we dissect this longitudinal line of the internal iliac artery, the umbilical artery, and when we mobilize this tissue medially or laterally, we will get to the lateral parametrial area, lateral paracervix area easily. So here you can see the deep connections of these vesicovaginal plexus vessels. Here you can find them. And this obturator nerve, you may understand, vesicovaginal plexus vessels, they drain into a common vein here. This is called deep uterine vein, or the main visceral vein, main visceral tributary of the pelvis, because it drains the vesicovaginal plexus vessels, and the pelvic splanchnic nerves and the hypogastric nerve lie inferior to it. So this area is important in nerve preserving structures, and this area is also called here the lateral paracervix. At this point, I want to show the somatic nerves or the lumbosacral plexus also. When we dissect the external iliac vessels from the psoas major muscle, here you can find the obturator nerve emerging from the psoas major muscle here. And inferior to it, we can find the lumbosacral trunk, which is arising from L4 and L5 here. And this is the greater sciatic notch here. And medial to the lumbosacral trunk, we will find the gluteal vessels or also the internal iliac vein. So this area is important for lateral paracervical dissection, for the dissection of the paracervical lymph nodes, and also the deep common iliac lymph nodes in cervical cancer surgery, also for the treatment of the sciatalgia, because the sciatic nerve is formed with the L4 and L5, the lumbosacral trunk, S1, S2, and S3, and we can find the nerve roots for the sciatic nerve roots at this medial psoas area. You can find the lumbosacral trunk inferior to the obturator nerve and follow this nerve to the infrapiriform region of the greater sciatic foramen here. And this is the point where the sciatic nerve is shaped. This area, infrapiriform part of greater sciatic foramen. And this is the lateral approach, medial psoas approach, and also you can find the lumbosacral trunk here. Look at this, inferior to the obturator nerve here. You can find the lumbosacral trunk here. And to get this area from the medial side, you need to cut the internal iliac vessels, internal iliac artery and the internal iliac vein. Otherwise, at the medial approach, from the medial approach, it's not easy to find these nerve structures, the lumbosacral trunk. And deep to the lumbosacral trunk, you may find the S1 nerve also here. This is the S1. And they merge with the lumbosacral trunk to form the sciatic nerve. And this is the main structure of the pelvis. And also, this is arcus tendinous fascia pelvis, traveling towards the perivesical space anterior to the bladder. This is the pubic bone level, and this is the obturator foramen level. The arcus tendinous fascia pelvis is very important. It covers the superior portion of the levator ana, pubococcygeus. And this area is also important. The presacral space anterior to the sacral bone, here you can find it, promontorium level, sacrum level, and rectosigmoid colon. So this bony structure of the pelvis is in connection, perivesical space, paravesical space, parectal space, and presacral space. We may call the presacral space the retrorectal space because presacral space means the anterior portion of the sacrum, but retrorectal space means all this area is also commonly used. And at the retrorectal area, we will find the nerve structures, autonomic nerve structures for the pelvis at this zone. At the lateral portion of the retrorectal space here, we may find the pelvic splanchnic nerves. This is the lateral portion of the retrorectal space again. And for the anterior zone, lateral to the perivesical space, at the lateral edge of the paravesical space, we may find the coronomortis vessels here. These are the coronomortis vessels. So this interconnected style of pelvis has a philosophy, and understanding this will solve many problems and give a route to difficult pelvic surgeries. Thank you. Now we will talk about the lateral part of the pelvis. The pelvis starts at the pelvic brim level. This is the promontorium level, first sacral vertebra. And anteriorly we will find the pubic bone. It's an important landmark also here. Between them we will find the pelvic structure. Promontorium continues with the linea terminalis. Laterally it divides the pelvis into the lesser pelvis and the greater pelvis, false pelvis and true pelvis. False pelvis lies at the line of the iliac fossa. Here you can find the iliacus muscle. When we cut the iliopsoas fascia, we will find the iliacus muscle here deeply, and this is the psoas major muscle. Between the iliacus muscle and the psoas major muscle, we will find the femoral nerve, and this is the femoral nerve, a very important structure for the movements of the human body. And this is the psoas major muscle, and superior to it we will find the genitofemoral nerve. It lies at the superior portion of the psoas major muscle. And medially we will find the external iliac vessels, the external iliac artery here, and the external iliac vein at this area here. This is the external iliac vein. And this is the common iliac artery. It divides into the external iliac artery and the internal iliac artery. And this area is the interiliac region between the external iliac artery and the internal iliac artery. We will find the external iliac vein, and this is the external iliac vein. Here you find it. At the inferior portion of the internal iliac artery, we will find the internal iliac vein. Here, this is the internal iliac vein. You will see it. And it's very important, and it will also have connections and anastomosis with the external iliac vein here. They will all have anastomosis, the internal iliac and the external iliac system. Here. And when we go medially, we will find some avascular spaces, lateral to the rectum, the parietal space, and lateral to the bladder, the paravesical space. This is the rectum, rectosigmoid colon, and at the medial side of the pelvis, this is the ureter. It lies attached to the broad ligament posteriorly, and at the medial portion of the ureter, we will find the rectosigmoid colon. And between the ureter and the internal iliac artery, here we find the parietal space. It's very important. During dissection of the parietal space, inferior to the ureter, we will find the hypoglossal nerve. It's the extension of the superior hypoglossal plexus here. The superior hypoglossal plexus is formed by the extensions of the thoracolumbar flankings, and they form the superior hypoglossal plexus. Actually, it's formed at the anterior side of the aorta, inferior or caudal to the inferior mesenteric artery, but now we will find it at the anterior portion of the left common iliac vein. This is the left common iliac vein. And this superior hypoglossal plexus gives the branch of the hypoglossal nerve, which is lying inferior to the ureter, approximately 2 centimeters inferior to the ureter, at the lateral portion of the rectum, rectosigmoid colon. Here you can find it. And the hypoglossal nerve conveys the sympathetic innervation to the pelvis, and the pelvic splanchnic nerves, which are found at the lateral part, dorsolateral part of the rectum here, merge with the hypoglossal nerve. The pelvic splanchnic nerves conveys the parasympathetic innervation, and they form the inferior hypoglossal plexus. This is the dominant pathway of autonomic nerves. It follows the path of the hypoglossal nerves and travels towards the bladder base, inferior to the vesicovaginal plexus vessels. Here you can see it. The bladder base area, this is the bladder base area, the vesicovaginal plexus vessels, and deeply the hypoglossal nerve plate runs at this area. And the pelvic splanchnic nerves are very important for this bladder functions and also the rectosigmoid and sexual functions here. They arise from S2 and S4 and travel obliquely towards the lateral side of the rectum or posterolateral side of the vagina here, and form the inferior hypoglossal plexus at this one. And here also we can find some fibers to the rectum here. Some autonomic nerve fibers arising from the inferior hypoglossal plexus here and traveling towards the rectum base. And here at the lateral part of the pelvis, we will find internal iliac vessels. When we cut the internal iliac vessels here, we will find the somatic nerves for the pelvis and the somatic nerves of the lumbosacral trunk. Here you can find them. When we dissect the lateral part of the pelvis and elevate the external iliac vessels here, we will find the obturator nerve here at the inferior portion of the external iliac vein. You can find it. It's emerging through the psoas major muscle and travels towards the obturator canal here, and exits the pelvis from the obturator canal here. But deep to the obturator nerve here, we can find some other somatic nerves. When we cut all the internal iliac system here, internal iliac vessels here from the origin, and when we elevate the external iliac system, inferior to the obturator nerve, here we will find somatic nerves. Lumbosacral trunk, this is the greater sciatic notch, here you can find it, greater sciatic notch. This is the lumbosacral trunk from L4 and L5, and this is S1 and this is S2. And they form the sciatic nerve at the infrapiriform part of the greater sciatic foramen here. When we cut the obturator fascia at this area, we will find these sciatic nerve roots here. Between the lumbosacral trunk and the S1 nerve, the superior gluteal artery passes towards the posterior superior part of the pelvis, towards the gluteal region, and it runs at this area. And at the inferior part, the inferior gluteal artery passes between the S1 and S2. This is the inferior gluteal artery. So the obturator fascia is important to get connection with this area. And also, there are some important branches of the internal iliac vessel system. This is the longitudinal continuation of the internal iliac artery, which travels towards the anterior abdominal wall. And the first medial branch from the internal iliac artery is the uterine artery. Here you may find the uterine artery. This is it. It passes from the anterior side of the ureter here, like this, from the superior side in surgical supine position of the ureter. When we cut it, we will get to the paracervix area. It's very important because vesicovaginal plexus vessels travel at this zone. And it's an important path for lymphatic metastasis in cervical cancer surgery. Here you can see the complex anatomy of this area. There will be always some connections between the supraperitoneal tissue and these vessels, and when we dissect them, we will find many important vessels. This is the uterine artery, umbilical artery,
the superior vesical artery.
Here you can find them. And when we elevate the uterine artery, here you can see the superficial uterine vein or some other arterial structures follow this area here. And more deeply, we may find some other structures. This is the vaginal artery here, vaginal artery, and this structure, which is accompanying to the uterine artery, this actually traveling from this area and draining into this vein. This is the deep uterine vein. Here you can find it. And this is another artery from the internal iliac artery, which also goes towards the deep pelvis, probably harboring the middle rectal artery and vaginal branches. So, uterine artery here, uterine artery here, superficial uterine vein here, vaginal artery, deep uterine vein, and again vaginal artery or middle rectal artery. And also this is the inferior gluteal artery, here you can see it, and the superior gluteal artery here. This is the superior gluteal artery. These are all branches related with the internal iliac vessel system. And also inferior to the internal iliac artery, this is the internal iliac vein, here you can see it, and the medial main visceral tributary draining the deep pelvis here at the inferior portion of the internal iliac vessels. You can find them at this zone. So this is also the paravesical space lateral to the bladder, here you can find it. The umbilical ligament divides the pervesical space into two parts, medial and lateral. When we dissect this umbilical ligament, umbilical artery, from the pervesical fatty tissue, it's actually attached to the pervesical fatty tissue. It divides the pervesical space into the medial and lateral parts. Medial part is important to identify the visceral structures of the pelvis. Here you can see them, and parametric resection. But the lateral part is important to identify the lateral paracervix here. Here you can find the lateral paracervix at this zone. These are the paracervical lymph node area, obturator nerve at the lateral part, and obturator vessels here. And this is the lateral paracervix. So lateral paracervical lymph node dissection can be performed at this zone. Lateral paracervical lymph node dissection is performed at this zone and also superior to the lumbosacral nerve roots. Here you can find the lumbosacral nerve and deeply S1 nerve, but superior to the lumbosacral nerve and at this area, lateral paracervic zone, we will perform the paracervical lymph node dissection. This is the obturator nerve at the inferior portion of the external iliac vein. It exits through the obturator canal here, and the obturator vein merges with the pubic anastomotic vessels, which is between the external iliac vessels or the inferior epigastric vessels and the obturator vessels. The pubic anastomotic vein, coronomortis vessel, lying at the posterior portion of the superior pubic ramus, the iliopectineal ligament here. This is the iliopectineal ligament level, which is important for birth co-suspension, is this level. These are the external iliac vessels, the vein and the artery. At the anterior portion of the external iliac vessels, there is no vessel, no branch to the level of the inguinal ligament. At the inguinal ligament level, inferior to the inguinal ligament or posterior in anatomical position, the inferior epigastric vein and the inferior epigastric artery arises towards the anterolateral abdominal wall, which supplies the deep anterolateral abdominal wall at the infraumbilical region. This is the pubic anastomotic vessel, which is between the inferior epigastric vessels or the external iliac vessels and the obturator vessels here. And it lies at the posterior portion of the superior pubic ramus. This is the iliopectineal ligament level. Here you can find it at the anterior or distal part of the pubic anastomotic vessels. And this is the obturator nerve, and obturator nerve exits the pelvis through the obturator canal. And this anastomotic vessels passes at the medial side of the obturator nerve, and they also pass through the obturator canal. And at this level, we will find the arcus tendinous fascia pelvis. This is the arcus tendinous fascia pelvis, the main branch for the structure of the pelvis, the main anatomical landmark for the steady structure of the pelvis. This is arcus tendinous fascia pelvis, the condensed fascia tissue between the obturator internus muscle and the levator ani muscles here. Thank you.